Question 1. A nurse is caring for a client with acute respiratory distress syndrome, ARDS, who is intubated and on mechanical ventilation. The nurse notes the peak inspiratory pressure, PIP, has increased from 28 cm H2O to 45 cm H2O, and the client's oxygen saturation has dropped from 94% to 88%. The client appears agitated. What is the most immediate nursing intervention? A. Administer a prescribed PRN sedative to reduce agitation. B. Auscultate bilateral lung sounds and assess for tracheal deviation. C. Increase the fraction of inspired oxygen, FiO2, per standing orders. D. Notify the respiratory therapist to assess the ventilator settings. Answer: B. Auscultate bilateral lung sounds and assess for tracheal deviation. The concept tested here is the immediate assessment and intervention for acute respiratory distress in a mechanically ventilated patient, specifically when facing a sudden increase in peak inspiratory pressure and desaturation. The key clues are most immediate and the sudden worsening of PIP and oxygen saturation, along with agitation, which point to a potential acute complication like a pneumothorax or kinked endotracheal tube. Auscultating lung sounds and assessing for tracheal deviation helps rapidly identify a tension pneumothorax or mainstem intubation, which are life-threatening and require immediate attention before other interventions. For example, if lung sounds are diminished on one side and the trachea is deviated, it indicates a tension pneumothorax requiring urgent medical intervention. Always prioritize ruling out immediate life-threatening complications before adjusting settings or administering medications. Question 2. A client with chronic obstructive pulmonary disease, COPD, presents to the emergency department with increased shortness of breath, copious green sputum, and a fever of 101.5 degrees Fahrenheit 38.6 degrees Celsius. The arterial blood gas, ABG, results are pH 7.28, PaCO 268 mm of mercury, PaO 255 mm of mercury, HCO 330 milliequivalent/L. Which acid-base imbalance does this client demonstrate? A. Metabolic acidosis with partial respiratory compensation. B. Respiratory acidosis with partial metabolic compensation. C. Respiratory alkalosis with full metabolic compensation. D. Metabolic alkalosis with partial respiratory compensation. Answer: B. Respiratory acidosis with partial metabolic compensation. This question tests the nurse's ability to interpret arterial blood gas, ABG, results to identify acid-base imbalances. The key clues are the pH, PaCO 2, and HCO 3 values, a pH of 7.28, acidic, and a PaCO 2 of 68 mm of mercury, high, indicating respiratory acidosis, show the primary problem is respiratory acidosis. The HCO3 of 30 milliequivalent/L, high, indicates that the kidneys are attempting to compensate by retaining bicarbonate, but since the pH is still abnormal, the compensation is only partial. For instance, in a COPD exacerbation, the lungs are unable to effectively blow off CO2, leading to its retention and a decrease in pH. When interpreting ABGs, first determine if the pH is acidic or alkalotic, then identify which system, respiratory via PaCO 2 or metabolic via HCO3, matches the pH disturbance, and finally, look for compensation by the other system. Question 3. A client with severe asthma is admitted to the hospital with status asthmaticus. Despite bronchodilator and corticosteroid administration, the client's condition is worsening, as evidenced by a rising PaCO 2 and diminished breath sounds. The nurse anticipates the client will require A. High-flow nasal cannula oxygen therapy. B. Continuous positive airway pressure, CPAP. C. endotracheal intubation and mechanical ventilation. D. Manual chest physiotherapy and postural drainage. Answer: C. Endotracheal intubation and mechanical ventilation. This question evaluates the nurse's understanding of progressive respiratory failure and the indications for mechanical ventilation, particularly in the context of status asthmaticus. The crucial clues are worsening, rising POC-O2, and diminished breath sounds, despite ongoing medical therapy. A rising POC-O2, hypercapnia, indicates inadequate ventilation and impending respiratory muscle fatigue, while diminished breath sounds in an asthma exacerbation signal severe bronchoconstriction and air trapping, often referred to as silent chest, which is a pre-arrest sign. These signs point towards respiratory failure, necessitating invasive ventilatory support to ensure adequate oxygenation and ventilation. For example, if a patient with asthma is too exhausted to breathe effectively, putting them on a ventilator can give their respiratory muscles a much-needed rest and help clear CO2. Recognize that a silent chest is an emergency and often means the patient is no longer moving air, requiring immediate, aggressive intervention. Question 4. A nurse is providing discharge teaching to a client with newly diagnosed idiopathic pulmonary fibrosis. Which statement by the client indicates a need for further teaching? A. I should get the flu and pneumonia vaccines every year. B. I will need to take anti-inflammatory medications for the rest of my life. C. I should report any increased shortness of breath or dry cough to my doctor. D. Pulmonary rehabilitation can help me manage my symptoms and improve my quality of life. Answer: B. I will need to take anti-inflammatory medications for the rest of my life. This question assesses the nurse's knowledge of the pathophysiology and management of idiopathic pulmonary fibrosis, IPF, and effective patient education. The concept being tested is accurate understanding of IPF treatment. The key clue is idiopathic pulmonary fibrosis and the statement that indicates a need for further teaching. IPF is characterized by progressive scarring of the lung tissue, not inflammation, and is managed primarily with antifibrotic agents, example pirfenidone, nintedanib, to slow disease progression, not long-term anti-inflammatory medications like corticosteroids, which have limited benefit and significant side effects in this condition. For example, telling a client with IPF that they need anti-inflammatory drugs indefinitely might lead them to take unnecessary medications or neglect their actual prescribed antifibrotic therapy. Remember that IPF involves fibrosis, not inflammation, so therapies are aimed at slowing scarring, not reducing inflammation. Question 5. The nurse is assessing a client with a history of recurrent pulmonary emboli. The client reports sudden onset of sharp chest pain, shortness of breath, and feeling lightheaded. Which assessment finding requires the most immediate intervention? A. Oxygen saturation of 91% on room air. B. Respiratory rate of 28 breaths/minute with shallow respirations. C. New onset S3 heart sound heard on auscultation. D. Blood pressure of 88/50 seconds millimeter of mercury with a heart rate of 118 BPM. Answer: D. Blood pressure of 88/50 seconds millimeter of mercury with a heart rate of 118 BPM. This question tests the nurse's ability to prioritize assessment findings in a client suspected of having a pulmonary embolism, focusing on signs of hemodynamic instability. The concept being tested is recognizing critical signs of hypoperfusion and shock. The key clues are most immediate intervention and the client's symptoms of chest pain and shortness of breath, strongly suggestive of a PE. While all options represent concerning findings, a blood pressure of 88/50 seconds millimeter of mercury, hypotension, coupled with a heart rate of 118 bpm, tachycardia, indicates cardiogenic shock or massive PE, which is a life-threatening emergency requiring immediate intervention to prevent organ damage and cardiac arrest. For instance, low blood pressure means vital organs are not receiving enough blood flow, which is more immediately dangerous than mild hypoxemia or a high respiratory rate. Always prioritize signs of circulatory collapse as they indicate immediate threat to life. Question 6. A client with a left-sided pleural effusion is scheduled for a thoracentesis. Before the procedure, the nurse should instruct the client to A. Lie flat in bed on their right side for the procedure. B. Cough forcefully to clear any secretions from the lungs. C. Remain absolutely still and avoid coughing during the procedure. D. Take deep breaths and hold them for as long as possible during the procedure. Answer: C. Remain absolutely still and avoid coughing during the procedure. This question assesses the nurse's knowledge of pre-procedure patient education for a thoracentesis, focusing on safety and preventing complications. The concept being tested is patient cooperation for a safe procedure. The key clue is before the procedure, indicating patient preparation. During a thoracentesis, a needle is inserted into the pleural space to remove fluid. Any sudden movement, such as coughing or shifting, can cause the needle to puncture the lung or other structures, leading to complications like a pneumothorax or hemothorax. For example, if a client coughs suddenly during the procedure, the needle could lacerate the lung, causing air to leak into the pleural space and collapse the lung. Emphasize to the client that stillness is crucial for their safety during this procedure. Question 7. A nurse is caring for a client with a new tracheostomy. Which action is essential for the nurse to include in the immediate postoperative care plan? A. Administering humidified oxygen via nasal cannula. B. Placing the client in a supine position to reduce swelling. C. Performing tracheostomy care every 4 hours. D. Ensuring the obturator is readily available at the bedside. Answer: D. Ensuring the obturator is readily available at the bedside. This question tests the nurse's knowledge of immediate postoperative safety priorities for a client with a new tracheostomy. The concept being tested is preparedness for emergency airway management. The crucial clue is immediate postoperative care, which highlights critical safety measures. The obturator is a guide used to insert the tracheostomy tube and is essential to reinsert the tube if it becomes dislodged or decannulated in the immediate postoperative period when the stoma is not yet mature. Without the obturator, reinsertion can be difficult or impossible, leading to airway obstruction. For instance, if the tracheostomy tube accidentally comes out, having the obturator nearby allows for quick and safe reestablishment of the airway. Always prioritize airway patency and have the necessary tools for reinsertion readily accessible. Question 8. A client is admitted with community-acquired pneumonia. The nurse observes the client exhibiting confusion, lethargy, and fine crackles in the bilateral lung bases. The client's temperature is 100.8 degrees Fahrenheit 38.2 degrees Celsius, heart rate 102 bpm, respiratory rate 24 breaths/minute, and oxygen saturation 90% on 2L nasal cannula. Which of the following is the priority nursing diagnosis? A. Activity intolerance related to generalized weakness. B. Impaired gas exchange related to alveolar capillary membrane changes. C. Imbalanced nutrition, less than body requirements related to increased metabolic demands. D. Acute pain related to inflammatory process in the lungs. Answer: B. impaired gas exchange related to alveolar capillary membrane changes. This question assesses the nurse's ability to prioritize nursing diagnoses based on immediate physiological threats in a client with pneumonia. The concept being tested is identifying the most critical physiological need. The key clues are priority nursing diagnosis and the client's symptoms, confusion, lethargy, and oxygen saturation of 90% on 2L nasal cannula, which point directly to issues with oxygenation and carbon dioxide elimination. Impaired gas exchange is the most life-threatening problem because it directly affects the body's ability to oxygenate tissues and remove waste products. While other diagnoses might be present, inadequate gas exchange can rapidly lead to multi-system organ failure and death. For example, if the body isn't getting enough oxygen, the brain and other organs won't function properly, leading to symptoms like confusion and lethargy. Always address issues affecting oxygenation and ventilation first. Question 9. A nurse is reinforcing teaching for a client with asthma who uses a metered dose inhaler, MDI, with a spacer. Which statement by the client indicates effective understanding? A. I should shake the inhaler and then immediately take a quick, deep breath as I press down. B. After inhaling, I should hold my breath for about 10 seconds, then exhale slowly. C. I will clean my spacer by rinsing it with hot water every few days. D. I should always use the inhaler once, then wait 30 seconds before taking another puff if needed. Answer, B. After inhaling, I should hold my breath for about 10 seconds, then exhale slowly. This question tests the nurse's knowledge of the correct technique for using a metered dose inhaler, MDI, with a spacer, crucial for effective medication delivery in asthma management. The concept being tested is proper inhaler technique. The key clue is effective understanding of MDI use with a spacer. After activating the MDI and inhaling the medication through the spacer, holding the breath for approximately 5 to 10 seconds allows the medication particles to settle deep within the lungs, maximizing absorption and therapeutic effect. Not holding the breath long enough or exhaling too quickly can result in less medication reaching the airways. For instance, if you don't hold your breath, the medication might just stay in the back of your throat instead of getting to your lungs. Proper technique ensures the medication can do its job effectively. Question 10. A client with a long history of smoking presents with persistent cough, weight loss, and hemoptysis. A chest X-ray shows a suspicious lesion. The nurse anticipates the most definitive diagnostic test for lung cancer will be A. Positron emission tomography, PET, scan. B. Sputum cytology. C. Bronchoscopy with biopsy. D. Computed tomography, CT, scan. Answer, C. Bronchoscopy with biopsy. This question assesses the nurse's understanding of the definitive diagnostic methods for lung cancer. The concept being tested is diagnostic confirmation for malignancy. The key clues are most definitive and the symptoms highly suggestive of lung cancer, including hemoptysis and a suspicious lesion. While other tests like CT scans or PET scans can detect lesions and assess metastasis, a biopsy, typically obtained via bronchoscopy or needle biopsy, is the only way to obtain tissue for pathological examination and confirm the presence of cancer cells. For example, a CT scan can show a mass, but only a biopsy can tell you if that mass is cancerous or benign. Remember that a definitive diagnosis of cancer always requires a tissue sample. Question 11. A nurse is providing care for a client receiving mechanical ventilation. The low-pressure alarm sounds. What is the initial action the nurse should take? A. Assess the client for disconnections or leaks in the ventilator circuit. B. Check the client's arterial blood gas, ABG, results immediately. C. Notify the respiratory therapist to troubleshoot the ventilator. D. Manually ventilate the client with a bag valve mask, BVM, device. Answer A. Assess the client for disconnections or leaks in the ventilator circuit. This question tests the nurse's immediate response to a low-pressure ventilator alarm, prioritizing patient safety. The concept being tested is troubleshooting ventilator alarms and immediate safety actions. The key clue is initial action in response to a low-pressure alarm. A low-pressure alarm indicates a loss of pressure in the ventilator circuit, most commonly due to a disconnection, leak, or cuff deflation. The nurse's immediate priority is to identify and correct the cause of the pressure loss to ensure the client is receiving adequate ventilation. For example, a quick check might reveal the tubing has become disconnected from the endotracheal tube, which can be reconnected quickly. Always check for simple, correctable causes before escalating to more complex interventions or calling for assistance. Question 12. A client with severe dyspnea from a pulmonary embolism has been prescribed unfractionated heparin. The nurse understands that the primary goal of this therapy is to A. Dissolve the existing clot in the pulmonary artery. B. Prevent the formation of new clots and growth of existing ones. C. Improve oxygenation and ventilation by dilating pulmonary vessels. D. Reduce inflammation in the pulmonary vasculature. Answer B. Prevent the formation of new clots and growth of existing ones. This question assesses the nurse's knowledge of the mechanism of action and therapeutic goal of unfractionated heparin in the management of pulmonary embolism. The concept being tested is anticoagulant pharmacology. The key clues are unfractionated heparin and primary goal of this therapy. Heparin is an anticoagulant, meaning it works by inhibiting factors in the clotting cascade, thereby preventing the formation of new thrombi and preventing the existing clot from getting larger. It does not dissolve existing clots. That is the function of thrombolytic agents. For example, giving heparin is like putting a stop sign on the road for new clots, not like sending in a demolition crew for the old ones. Remember, anticoagulants prevent clot formation, while thrombolytics break down existing clots. Question 13. A nurse is caring for a client with active tuberculosis who is receiving multi-drug therapy. Which statement indicates the client understands the most important aspect of medication therapy? A. I can stop taking my medications when I start feeling better. B. I need to take these medications every day for several months. C. I should isolate myself completely from my family until the cough resolves. D. I only need to take the medications if my symptoms worsen. Answer B. I need to take these medications every day for several months. This question tests the nurse's understanding of client education regarding adherence to long-term medication therapy for tuberculosis. The concept being tested is adherence to a complex medication regimen. The key clue is most important aspect of medication therapy for active tuberculosis. Treatment for active TB involves a multi-drug regimen taken for several months, typically 6 to 9 months, to effectively eradicate the infection and prevent drug resistance. Stopping medications prematurely can lead to recurrence, drug-resistant TB, and continued transmission. For example, if someone stops their TB medications early, the bacteria can learn to resist the drugs, making future treatment much harder. Emphasize that consistent, long-term adherence is paramount for successful TB treatment. Question 14. A nurse is monitoring a client who underwent a lobectomy and has a chest tube connected to a water seal drainage system. The nurse observes continuous bubbling in the water seal chamber. What is the most appropriate initial action? A. Document the finding as normal post-lobectomy. B. Increase the suction to the chest tube system. C. Check all connections from the chest tube insertion site to the drainage system for leaks. D. Clamp the chest tube tubing near the insertion site to assess for air leak source. Answer: C. Check all connections from the chest tube insertion site to the drainage system for leaks. This question evaluates the nurse's immediate response to a common chest tube complication, continuous bubbling in the water seal chamber. The concept being tested is troubleshooting chest tube drainage systems. The key clue is continuous bubbling in the water seal chamber, which indicates an air leak within the system or from the client's lung. The initial and most appropriate action is to systematically check all connections from the chest tube insertion site to the drainage system to identify and correct any external leaks, as these are often the easiest to fix and prevent air from entering the system. Clamping the tube is generally discouraged unless specifically ordered or during very specific, brief assessments, and increasing suction will not resolve an air leak. For instance, sometimes a simple loose connection at the dressing or between tubing segments can cause constant bubbling. Always look for and fix external leaks first. Question 15. A client with advanced chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy at 2 liters per minute via nasal cannula. The nurse understands that delivering high concentrations of oxygen to a client with COPD can be detrimental primarily because it can A. Increase the risk of oxygen toxicity and lung damage. B. Suppress the client's hypoxic drive to breathe. C. Lead to severe vasoconstriction of pulmonary arteries. D. Cause absorption atelectasis and collapse of alveoli. Answer: B. Suppress the client's hypoxic drive to breathe. This question assesses the nurse's critical understanding of oxygen therapy considerations specifically for clients with advanced COPD. The concept being tested is the physiological basis of breathing in COPD. The crucial clue is advanced chronic obstructive pulmonary disease, COPD, and the potential for detrimental effects of high oxygen. In clients with chronic hypercarbia due to COPD, their primary respiratory drive shifts from carbon dioxide levels, which are chronically high, to hypoxemia, low oxygen levels. Administering high-flow oxygen can remove this hypoxic stimulus, causing the client to hypoventilate and dangerously retain CO2, leading to respiratory acidosis and potentially respiratory arrest. For example, if a COPD patient is given too much oxygen, their body might think it doesn't need to breathe as hard, causing their breathing rate to slow down too much. Always use the lowest effective oxygen dose for COPD clients to maintain adequate oxygenation without suppressing their respiratory drive. Question 16. A client presents to the emergency department with sudden onset of severe inspiratory stridor, difficulty speaking, and drooling. The nurse's priority action should be to A. Administer intravenous antibiotics immediately. B. Prepare for emergency intubation or tracheostomy. C. Obtain a detailed medical history from the client. D. Encourage the client to cough vigorously to clear the airway. Answer: B. Prepare for emergency intubation or tracheostomy. This question tests the nurse's immediate priority in a client presenting with signs of acute airway obstruction. The concept being tested is rapid assessment and intervention for a compromised airway. The key clues are sudden onset, severe inspiratory stridor, difficulty speaking, and drooling, which are classic signs of epiglottitis or severe upper airway obstruction. These symptoms indicate impending or complete airway occlusion, a life-threatening emergency. The nurse's priority is to secure the airway, often requiring emergency intubation or surgical airway. For example, if a child suddenly develops stridor and drooling, delaying intervention to take a history or administer antibiotics could lead to complete airway collapse. Always prioritize maintaining a patent airway above all other interventions. Question 17. The nurse is caring for a client with pneumonia who has developed acute respiratory failure requiring mechanical ventilation. The client's PaO2 is 58 mm of mercury despite an FiO2 of 80% and positive end expiratory pressure, PEEP, of 10 cm H2O. The nurse notes diffuse bilateral infiltrates on the chest X-ray. This clinical picture is most consistent with A. Acute exacerbation of asthma. B. Pleural effusion. C. Acute respiratory distress syndrome, ARDS. D. Community-acquired pneumonia. Answer: C. Acute respiratory distress syndrome, ARDS. This question tests the nurse's ability to identify key diagnostic indicators of acute respiratory distress syndrome, ARDS. The concept being tested is distinguishing ARDS from other respiratory conditions based on clinical presentation. The key clues are acute respiratory failure requiring mechanical ventilation, PaO2 of 58 mm of mercury despite an FiO2 of 80% and PEEP of 10 cm H2O, indicating refractory hypoxemia, and diffuse bilateral infiltrates on the chest X-ray. These findings, particularly the severe hypoxemia that is resistant to high oxygen concentrations and PEEP, along with widespread lung infiltrates, are hallmark characteristics of ARDS. For instance, if a patient with pneumonia rapidly worsens and their oxygen levels plummet even with high oxygen support, ARDS is a strong possibility. Understanding ARDS criteria helps in early recognition and appropriate management. Question 18. A client with obstructive sleep apnea is prescribed a continuous positive airway pressure, CPAP, device. The nurse should include which instruction when teaching the client about CPAP use? A. You should only use the CPAP when you feel sleepy during the day. B. Make sure the mask fits tightly to prevent air leaks and ensure effectiveness. C. You can remove the CPAP mask if you wake up with a dry mouth or nasal congestion. D. Clean the mask and tubing weekly with a mild soap and water. Answer: B. Make sure the mask fits tightly to prevent air leaks and ensure effectiveness. This question assesses the nurse's knowledge of proper CPAP use for obstructive sleep apnea. The concept being tested is effective and safe use of a CPAP device. The key clue is CPAP device and instruction. A proper, tight seal of the CPAP mask is essential for the device to deliver consistent positive airway pressure, preventing air leaks that would reduce its effectiveness in keeping the airway open during sleep. Air leaks diminish the therapeutic pressure, compromising treatment for sleep apnea. For example, if the mask is loose, air will escape, and the pressure won't be enough to prevent the airway from collapsing. Stress the importance of a good mask fit for effective therapy. Question 19. A nurse is assessing a client with suspected acute bronchitis. Which assessment finding would be most characteristic of acute bronchitis? A. Dullness to percussion over lung fields. B. High fever with chills and pleuritic chest pain. C. Dry, hacking cough that becomes productive of clear or purulent sputum. D. Significant wheezing and prolonged expiratory phase. Answer C. Dry, hacking cough that becomes productive of clear or purulent sputum. This question evaluates the nurse's ability to differentiate the classic symptoms of acute bronchitis from other respiratory conditions. The concept being tested is characteristic signs and symptoms of acute bronchitis. The key clue is most characteristic of acute bronchitis. Acute bronchitis is primarily an inflammation of the bronchi, often viral in origin, leading to a persistent cough. Initially, the cough may be dry and irritating, but as the inflammation progresses, it often becomes productive of sputum that can be clear, yellowish, or green, indicating the presence of inflammatory cells or bacterial secondary infection. Other options suggest different conditions: pneumonia, asthma. Knowing typical presentations helps you recognize common respiratory illnesses. Question 20. A client is prescribed a new inhaled corticosteroid for long-term control of asthma. Which instruction is most important for the nurse to provide regarding this medication? A. Use this inhaler only when you feel short of breath. B. Rinse your mouth thoroughly with water after each use. C. This medication will provide immediate relief of your asthma symptoms. D. You can stop using your rescue inhaler once you start this medication. Answer B. Rinse your mouth thoroughly with water after each use. This question tests the nurse's knowledge of essential client education for inhaled corticosteroids. The concept being tested is safe and effective use of inhaled corticosteroids. The key clue is most important instruction for a new inhaled corticosteroid for long-term control. Inhaled corticosteroids can cause oral candidiasis, thrush, or dysphonia, hoarseness, due to local deposition of the medication in the mouth and throat. Rinsing the mouth and gargling with water after each dose helps minimize this local irritation and reduces the risk of fungal infections. For example, if you don't rinse your mouth, you might develop a white coating on your tongue and throat, making it uncomfortable to eat. Always teach clients to rinse their mouths after using inhaled corticosteroids to prevent oral complications. Question 21. A client with chronic stable angina develops acute shortness of breath, pink frothy sputum, and crackles throughout all lung fields. The nurse assesses a blood pressure of 160/98 mmHg and a heart rate of 110 bpm. Which condition is the client most likely experiencing? A. Pneumonia. B. Pleural effusion. C. Acute pulmonary edema. D. Spontaneous pneumothorax. Answer C. Acute pulmonary edema. This question assesses the nurse's ability to recognize the classic signs and symptoms of acute pulmonary edema, especially in a client with cardiac history. The concept being tested is differentiating causes of acute respiratory distress. The key clues are acute shortness of breath, pink frothy sputum, and crackles throughout all lung fields, particularly in a client with chronic stable angina and hypertension. These are hallmark signs of fluid accumulation in the alveoli due to left-sided heart failure, leading to pulmonary edema. The pink frothy sputum is characteristic of fluid mixing with air and capillaries in the lungs. For instance, if the heart can't pump blood forward effectively, pressure builds up in the lungs, forcing fluid into the air sacs. Recognizing this cluster of symptoms is crucial for timely intervention. Question 22. A nurse is suctioning a client with a tracheostomy tube. The nurse notes the client's heart rate drops from 90 bpm to 60 bpm and oxygen saturation decreases to 85% during the procedure. What is the most appropriate initial action? A. Discontinue suctioning immediately and hyperoxygenate the client. B. Continue suctioning for no more than 15 seconds. C. Instill normal saline into the tracheostomy tube to loosen secretions. D. Notify the physician immediately about the adverse reaction. Answer: A. Discontinue suctioning immediately and hyperoxygenate the client. This question tests the nurse's immediate response to adverse reactions during tracheostomy suctioning. The concept being tested is recognizing and managing complications of suctioning. The key clues are the sudden drop in heart rate, bradycardia, and oxygen saturation, hypoxemia, during suctioning. These are common and potentially dangerous vagal responses or consequences of hypoxemia during the procedure. The most appropriate initial action is to immediately stop the stimulus, suctioning, and provide oxygen, hyperoxygenate, to reverse the hypoxemia and potentially the bradycardia. For example, if a patient suddenly becomes bradycardic or desaturates, the first thing to do is to stop the procedure causing the distress and give oxygen. Prioritize immediate patient physiological stability over completing the procedure. Question 23. A client is prescribed albuterol via nebulizer for an acute asthma exacerbation. The nurse explains that albuterol is a short-acting beta-2 adrenergic agonist. The primary expected outcome for this medication is A. Decreased inflammation in the airways. B. Reduced mucus production. C. Bronchodilation and improved airflow. D. Suppression of the immune response. Answer: C. Bronchodilation and improved airflow. This question assesses the nurse's understanding of the primary therapeutic effect of albuterol in asthma management. The concept being tested is the mechanism of action of short-acting bronchodilators. The key clues are albuterol, short-acting beta-2 adrenergic agonist, and primary expected outcome. Albuterol primarily works by stimulating beta-2 receptors in the bronchial smooth muscle, leading to relaxation of these muscles and widening of the airways, bronchodilation. This rapid bronchodilation quickly improves airflow and relieves symptoms like wheezing and shortness of breath during an acute exacerbation. For instance, if someone is having an asthma attack and their airways are tight, albuterol helps to open them up quickly so they can breathe easier. Understand that rescue inhalers like albuterol are for immediate relief by opening airways. Question 24. A nurse is providing care to a client who underwent a left pneumonectomy. The nurse notes tracheal deviation to the left side. What is the significance of this finding? A. It indicates a developing tension pneumothorax. B. It is an expected finding due to the removal of the lung. C. It suggests a new pleural effusion on the right side. D. It points to subcutaneous emphysema in the neck. Answer: B. It is an expected finding due to the removal of the lung. This question tests the nurse's knowledge of expected postoperative findings after a pneumonectomy. The concept being tested is anatomical shifts post-pneumonectomy. The key clues are left pneumonectomy and tracheal deviation to the left side. After a pneumonectomy, the entire lung is removed, creating an empty space in the thoracic cavity. Over time, the mediastinum, including the trachea, heart, and great vessels, shifts towards the operative, empty, side to fill this space. This is a normal and expected physiological adaptation, not a complication like a tension pneumothorax, which would cause deviation away from the affected side. For example, if you remove one lung, the structures inside the chest cavity will naturally shift towards that empty space. Understand the normal compensatory changes to differentiate them from complications. Question 25. A client with a severe exacerbation of COPD is receiving non-invasive positive pressure ventilation, NIPPV, via BiPAP. The nurse identifies which assessment finding as indicating the therapy is effective. A. Increased accessory muscle use. B. Respiratory rate decreased from 30 to 18 breaths/minute. C. Client reports increased dyspnea and anxiety. D. Development of skin breakdown under the mask. Answer: B. Respiratory rate decreased from 30 to 18 breaths/minute. This question assesses the nurse's ability to evaluate the effectiveness of non-invasive positive pressure ventilation, NIPPV, in improving respiratory status. The concept being tested is recognizing positive therapeutic outcomes of BiPAP. The key clue is indicating the therapy is effective. BiPAP is used to reduce the work of breathing, improve gas exchange, and decrease respiratory distress. A decrease in respiratory rate, especially from a high, labored rate, indicates that the client's breathing effort has lessened and ventilation is improving. This reduction in tachypnea is a direct sign of decreased respiratory distress and more efficient gas exchange. For example, if a patient is breathing very fast and hard due to COPD, a successful BiPAP treatment will help them breathe more slowly and easily. Look for signs of reduced respiratory effort and improved breathing patterns to determine effectiveness.